Everyone, welcome to my channel Ravi Static Video. So in the series of pharmacology of cardiovascular, we are moving further and taking calcium channel blockers. So the calcium channel blockers are the blocking agent of calcium into our heart muscle for reduce the vascular pumping and cardiac contractility. If it means there is too much contraction of the heart muscle, so it will be relaxed, and the dilation of the vessels for the decreased blood pressure. So the calcium channel blockers, also known as calcium antagonists, are a class of drug that disrupt the movement of calcium through the calcium channel. It means they are binding to the calcium channel into the interstitial side of the cell, and the enters of the calcium into the cell, it will be block them, so not enter into them. So they are primarily used to manage cardiovascular condition by inhibiting the enter of calcium ion into the excitable cell, specifically the cardiac muscle and vascular smooth muscle, and the agent promote vasodilation, decrease myocardial contractility, and modify heart rate and conduction. So basically, we are using the calcium channel blocker to reduce the cardiac muscle contractility and reduce the heart rate conduction. Classification of the calcium channel blockers. First is dihydropyridines. These are primarily potent vasodilator which little to non-effect on cardiac conduction to therapeutic doses. It means they dilate basically dihydropyridines are work into the all over the arteries, vessels, and vein into our whole body, and it will be relax them by the dilation of the vessels. So the example of dihydropyridines are nifedipine and amlodipine and fluidipine. So first is dihydropyridine, next is to be non-dihydropyridines. So primarily target the heart and blood vessels. They act as a negative inotropes, reduce the contractility, and the chemotropes reduce heart rate while causing vasodilation. Non-dihydropyridines are basically those kind of drugs we are using on that time if the contraction of the heart muscle is too high and the constriction is over there, and there is on that situation there is high blood pressure was there, and arrhythmias you have been shown of the patient, and the contractility heart also will be high. So the example of drugs are Verapamil and Diltiazem. So it will be reduce the heart muscle, or basically heart vessel or heart muscle. Mechanism of action. So CCBs binds to the long-lasting voltage-gated calcium channel located in the plasma membrane of smooth muscle and cardiac cell. So basically, it binds to the CCB are bind here, and if calcium channels are enter into the cell, so it will be block them, and after that it will be return outside of the cell. So it will be relax them. So vascular smooth muscle by blocking the calcium entry by prevent the activation of the calmodulin myosin tight chain kinase pathway leading to muscle relaxation and arterial vasodilation. Cardiac muscle, they reduce the plateau phase of the action potential, decreasing the force of contraction, negative dermotropic. It means it relaxes the heart muscle, it relaxes the vessels of the heart and throughout the vessels of the body. So that is the mechanism action of the drug. Pharmacological action. In cardiovascular, decrease the blood pressure due to reduce the peripheral vascular resistance. If the calcium channels are blocked and not enter into the blood vessel, so it will be leads to decrease the blood pressure. Myocardial oxygen demand, reduce the demand due to the decreased afterload and reduce the heart rate. It means there is too much pressure of the blood reach in our full heart muscles all throughout the body. So on that time there is too much oxygen demand is fulfillment in our body. So on you are taking the calcium channel blocker, so it will be reduce them, and after load it will reduce the heart rate and reduce the myocardial oxygen demand. What will be effect in renal? Some CCBs may produce a mild natriuretic effect, excretion of sodium. So some diuretics are show the effect it will in the urination you have to be shown the too much sodium of the salty urine, it will be excreted out of our body. What will be happening in smooth muscle? Relax of non-vascular smooth muscle like bronchodilation and esophageal relaxation through this effect are clinically less prominent. So it will relax heart muscle, decrease blood pressure, and decrease contractility of heart and relaxation occur. Indication. So these medication are given on those patients who have hypertension, angina pectoris, cardiac arrhythmias, and Raynaud's disease. Raynaud's disease are present on small joints for the reduction of the like blood pressure and hypertrophic cardiomyopathies. What is the action of pharmacokinetical if the drugs are entered? So absorption, well absorbed following oral administration. Metabolism, subject is to be extensive first pass metabolism into the liver. So absorption is to be good if you are taking the oral drugs. Metabolism, you have to be shown into the liver, and CYP3A4 enzyme is to be break down them. Bioavailability often low because it will be so fast pass metabolism into the liver, and the formulation of amlodipine have the better profiles to it will be like not like demolatized into the liver, and it will be reached out into the systemic circulation very easily. And excretion primarily eliminate by the kidneys as indicative metabolites. Side effects and toxicity, like dihydropyridine and non-dihydropyridine both have shown a peripheral edema like ankle swelling, flushing, headache and dizziness, reflex tachycardia. Non-dihydropyridines are constipation, bradycardia and heart attack. You have to be shown. Toxicity overdose can lead to severe hypotension, perfusion and bradycardia. You have to be shown, and hyperglycemia. Contraindication, severe hypotension, CCB lower the blood pressure further. Heart failure with reduced ejection fraction, second and third degree atrioventricular block, sick sinus syndrome, and if pregnancy have to be shown, the contraindicated for calcium channel blocker on these patients. Thank you.